This video describes a technique for ultrasound-assisted needle deflation and arthroscopic removal of a migrated subacromial balloon. These arthroscopic views are from a posterior lateral portal of a right shoulder. The patient underwent a revision rotator cuff repair. Because of the poor tissue quality, the repair was augmented with an in-space subacromial balloon which is seen being inserted over the repaired cuff tissue on the left. On the right is shown the size medium balloon after inflation to the appropriate volume. The balloon spacer was stable to immediate shoulder passive range of motion. At 5 days post-op, the patient noted an acute increase in anterior shoulder pain and presented to our clinic with a prominent anterior shoulder bulge seen here consistent with anterior balloon migration. We offered ultrasound needle deflation with possible arthroscopic balloon removal. The patient was placed in a semi-reclined position and a sonocyte ultrasound transducer was oriented in a sagittal axis over the anterior shoulder. Imaging confirmed anterior migration of the balloon into the subdeltoid space. The anechoic oval space was consistent with a fully inflated balloon. The skin was prepped and anesthetized with local anesthetic, and a sterile 18-gauge needle was placed in line with the transducer from anterior to posterior. The needle is shown here after it has pierced the balloon using in-plane ultrasound guidance. The inferior wall of the balloon is noted to shift superiorly as the balloon decompresses. 17 cc's of saline was aspirated from the balloon, which correlated with the amount initially inserted at the index procedure. An external view of the right shoulder shows 17 cc's being aspirated from the anteriorly migrated balloon. After aspiration, the deflated balloon remained visible and palpable under the skin as noted in these images, and the patient continued to have significant anterior shoulder pain. We therefore offered arthroscopic removal of the balloon. The patient was brought to the operating room and placed in the beach chair position. The arthroscope was initially placed in the original posterior portal. The previous repair remained intact, but the balloon was not easily visible from the posterior viewing portal. The arthroscope was then placed in the posterior lateral portal, and the balloon was noted to have migrated anteriorly above the capsule into the subdeltoid space. A locking grasper was placed through the anterior lateral portal, and the balloon was secured. The balloon was removed and noted to be intact. The portals were closed in the standard fashion, and the patient returned to routine post-operative protocol. Thank you for watching this video.